Well, good afternoon, everyone. I think in most cases it's the afternoon for folks. My name is Megan Wilden, and it is my honor and pleasure to be the Executive Director of OLLI, the Osher Lifelong Learning Institute at Berkshire Community College. And as many of you know, one of the most wonderful things about OLLI is that the extraordinary programs that we present are developed by our members themselves. Our members who volunteer on committees to put together classes and special events. Often our members teach our classes, as in the case with Mary Lou, and do so many other things, including serving on our board of directors. And we're very lucky to have our board president here with us today. So if you're new to OLLI, and even if you're not, I encourage you to think about getting involved in helping create classes or find speakers or create special events, the kind of programming that you'd like to enjoy. The best way to have that programming occur is by helping to make it happen. We have 4 curriculum committees, and they are science, the arts, literature, and social science, and the first 3 are all open to new members. So if that's any of those areas are of interest to you, please send an email to the OLLI office at olli@berkshirecc.edu, and we'll be happy to connect you. I also want to say thank you so much to everyone here who contributed to our annual appeal this year. We're very grateful for your support, especially in this challenging year we've had, and the annual appeal helps ensure that we keep our fees and membership fees low, that we are able to provide scholarships for those in need, that we are able to provide free community programs for everyone's benefit, and much more. So, and if you haven't had a chance yet to contribute, there's still time. Andy's just put the link to do so online in the chat, and we welcome and are so appreciative of your support. And now it is my great pleasure to introduce the OLLI ringleader, Barbara Lane. She is the board president, and she's a fabulous one. She serves on so many committees, I don't think I could name them all. And she has helped us see through this exciting year with a smile and a graciousness and a sense of humor second to none. So please join me in welcoming Barbara Lane, who will introduce our fabulous instructor.
Oh, thank you so much, Megan, and welcome everyone. It is always a pleasure for me to introduce one of our outstanding lecturers, but it's a double pleasure for me today because I'm introducing someone who also happens to be a dear personal friend of mine, Dr. Mary Lou Hyson. Mary Lou holds a PhD from Bryn Mawr College in Child Development and Early Childhood Education, and has published books, chapters, and reports on early childhood development and early childhood teacher education. She's a national and international consultant in early childhood development and education, specializing in early childhood professional development, including teacher education, social and emotional development, and children's approaches to learning. Formerly, Mary Lou was an SRCD Fellow in the U.S. Department of Education and chair of the University of Delaware's Department of Individual and Family Studies. After that, she was the Associate Executive Director and Senior Consultant with the National Association for the Education of Young Children. Currently, Mary Lou is a senior consultant to both the World Bank and UNICEF and has supported work on early childhood standards, curriculum, and professional development, frankly, in too many countries for me to list here. This course on children and COVID-19, its impacts, interventions, and support could not be more timely, and I know I couldn't leave you in better hands. So welcome, Mary Lou.
All right. I'm slowly getting into the technology here. I am unmuted, and I think if I share my screen, I will have my slides, correct?
I see your slides.
There we go. You see them, right?
Yep.
Excellent.
And
Okay.
you sound great, by the way. The internet, the Wi-Fi is much clearer now.
Well, it may have been that John turned off his computer, which usually is just sort of running in the background. I don't know. Because usually, I mean, I've done some Zoom stuff and it seems to work okay. So anyway, Barbara, thank you for that introduction. And I will zoom right ahead. First of all, I just want to say how delighted I am to be able to do this with you. And I want to thank all of you for participating. Let me just first very quickly share with you what I see as sort of the agenda for today's session. And first, a few quick introductions, and then I want to just preview what the overall goals of this course are, what the content is, and what the typical format will be. And then we're going to get into a bit more specifically some of the issues and challenges for children's development that are posed by the pandemic. Then I thought we could have a look at how children make sense of what is happening. How do they understand and what do they feel about the pandemic? Then some tips for adults in communicating with children about these issues. And we'll have some discussion as we go along. We'll kind of play around a little bit with how that might work. Again, I'll be feeling my way a bit as well, but we'll have some general discussion, I hope, at the end. I really want to emphasize, I'll say more about this later, that as we go along, if there are topics, issues, resources, anything that you really would like more information about, more opportunity to discuss, I really ask you, I put in the chat my email address, and it was also on the first slide. So please just, jump out and let me know what would make this a good source of insight for you, as well as for other people that you may be in touch with. So Barbara introduced me, and I don't have anything else to say about myself. I live in Stockbridge, still doing consulting remotely, mostly with UNICEF, and I'm actually hoping maybe to plug in from Geneva my friend Evelina Borisova, who's the head of all the early childhood stuff in that region, because I've worked with her on some resources. But anyway, I want to welcome the people in this course. I think too many people to have individual introductions, but I hope over the weeks that you'll make yourself known in one way or another. And also I want to say that as was referred to a little bit, I think earlier, there are several groups of early childhood practitioners in the Berkshires, primarily connected with Child Care of the Berkshires organizations, some folks from BCC who have a particular interest in these issues. And thankfully and generously, they will be able to access, if they're not able to participate live, they will be able to access the recordings and also the resources which Andy had sent, and I'll say a little bit more about that later. So as I said, I'm familiar with Zoom. I've done single presentations. This is the first OLLI course that I've done and the first Zoom course as such. I was mentioning to Andy, I do have a son who is teaching full-time Zoom at the University of Wisconsin campus, and he's been my main technical advisor. But I really ask for suggestions as we go along during this course via chat, email, anything like that. Most of you, I think, are veterans of OLLI, but I should say that Andy is a great technical resource. Please reach out. And Karen is going to be a great support to me at times when we're managing chats maybe, or I may get brave enough to try some hand raising or something. And please contact me if I can be useful using my email address in between sessions. I love finding resources for people, and I kind of, say at my age that I don't know everything, but I kind of know everybody in my field. At least I know a lot of people, and that I can tap into for insights. So you should have received, I want to say a little bit more about the resources. You should have received the first installment of the resources. The pattern will be some days in advance of each of the following sessions, you will receive an attachment that has both resources specific to that content for that week, always with links to online resources. And I'll keep pasting in a set of general resources that cut across different topics, just so that you don't have to find a place to keep it or whatever. And there is no reading for this class. This is simply a way for me to share with you some of the incredibly informative and insightful materials that are available on most of these topics. So everything that I will be talking about or sharing in these live sessions, it has some kind of a link or resource that you can have more of an in-depth look at. But as I say, I think these will be a supplement to what will be explored in the sessions. So a little bit about the overall goals and content and format. As I was thinking about this the other night, I guess I see three broad goals for this OLLI course: information, insights, and empowerment. And what I mean by that is not just information about the pandemic, COVID-19, but what's being done, what can be done to support children's development, especially in the first 12 years or so of life. Insight, what I'm thinking about is I hope you gain insight into how both children and adults are thinking and feeling. Some of it, I hope, will be sharing your own insights. And empowerment, what I'm thinking is whatever the nature of your engagement with issues around COVID-19, around the pandemic, whether it's as an interested citizen, practitioner, current or former, a grandparent, a parent, I hope that you'll feel somewhat more empowered to make a difference in ways that are important to you. So a little bit about what the focus and the sessions are going to be about. So today is kind of an introductory overview with content, but I also wanted to mention that although I really want to focus on child development, the primary focus, as you kind of see from the slide, is not physical development or health. That isn't my area of expertise. Certainly there are connections, and I can try to make those and find resources for some of those specific questions. But the focus will be on areas such as children's emotional well-being, children's learning, cognitive development, all of those areas of development. And the next two sessions will focus, partly because I'm trying to meet the needs also of the childcare, of the Berkshires practitioners, primarily focusing, although there'll be overlaps, on children from birth up to about age 5 or so, with focus first on their emotional health and well-being, and then on the area of cognitive development and learning. And then the same sort of general pattern for the next 2 weeks, but with more of a focus on school-age children, and with subtopics within each. And as I'm developing this, there are a lot of intersections and overlaps. So, you know, I wouldn't feel like, oh, well, I'm not really that interested in younger children and so on. I hope there will be lots of applications across. Also, if there's interest, we can discuss teens as well. And I would count on you to let me know if that's an interest to a number of people. I actually, one of the first courses that I taught years ago when I was at the University of Delaware was adolescent development. I did feel like I knew a lot about it then, but there's nothing like teaching a class to, you know, get you up to speed pretty quickly. So I do have a lot of resources that I could share. And then in the last session, although again, we'll touch on this earlier, the focus will be on caring for the adults. What do we know about the stresses on adults, whether they're caring for children as parents, whether they're involved in as grandparents, extended family, teachers, childcare providers, family childcare, home visitors? What are the supports that are or can be provided for them? As far as the format, kind of a framework will be, at least for the next 4 weeks or so, thinking first about what goals are for children's development within whatever the age focus is, and how that development will be and is being challenged by COVID-19. So what do children need for healthy development? How is that development being challenged? And what are some ways in which development can be strengthened and supported? And in each session, there will be a lot of resources referred to, some video. I'm going to try my hand at a couple of those, sharing other materials via screens. There may be, as I mentioned, some brief outside presentations, but I also have, and I have a couple of examples today, some videos that with people who have expertise in these areas. And I'm really hoping either using the chat feature, which I think most people are familiar with. If you look on the top or the bottom of your screen, if you just click on chat, right, you can type something in anytime. And there's also, if you click participants and you scroll down, there's a raise hand feature if you would just like to say something as opposed to typing them in.
Oh, I'm sorry, Mary Lou, may I interrupt real quick?
Please.
For those of you who have updated Zoom more recently, the raise hand feature has moved to reactions. So it's the little smiley face towards the lower right of your screen. The raise hand feature is now under there. So if you have an older version, it will be under participants, as Mary Lou just said. If you've updated recently, it's now under.
Thank you. So it may have wandered or it may not have. Thank you. Let me then, before I move into the actual content of the course, just pause a minute to see if there are logistical questions from anybody. And you could, Andy, you may need to help me out here. Would they be able to type something into the chat at this point? Or do I have to get out of share screen? Andy?
Mary Lou, they can type it into the chat at this point.
Okay.
It should come up.
Okay, so let me just pause for a minute and see if anyone has some specific questions about the logistics of the class or anything that I've said so far about how we're going to be running this. Tom? Karen, are you seeing anything kind of popping out?
I don't see
Nope.
any questions at this point.
Okay, well, you as usual in these kinds of classes, feel free at any point to put anything into the chat, and Karen's going to help kind of monitor that so we can always cycle back at various points. Okay, great. Okay, let me see. Here we go. Look at that. I was pretty excited about those graphics, but I'm just like, Google Images is really terrific. So the big overarching question here is how the pandemic might impact children's development. And that's, in a way, the overarching question for this course, right? This might be, if you're still thinking about chat, this would be an opportunity. I would love to see at least a few people open their chat and just type in, you don't have to put your name or anything like that, one way in which you think this COVID-19 is impacting or potentially can impact children's development of any age. So let's just pause for a few minutes and help me out here, people, with a few observations.
We have one in terms of the impact on children's social development.
Ah, okay. Please keep typing. Let me just say a few words about that. In a few minutes, I actually have, if my technology cooperates, a really nice, very short video that I can show you from an amazing expert. And I mean, she's somebody that I've actually known for years and did some research with years ago, Kathy Hirsch-Pasek at Temple University. And she's become kind of a go-to guru on television news programs and as a commentator on all things related to child development, but she's quite thoughtful about some of those issues. Karen, is there something else that is being shared? Social development.
Yeah, there are a couple of others.
Thank you.
Let me get to them. Okay, behavior and mental health.
Yeah, behavior and mental health. Lots of evidence. And again, a lot of these we're going to cycle back to in later sessions, but there's a lot of evidence, not just anecdotal, from researchers of increases in all kinds of mental health challenges for children and adults of various ages, and parents being challenged by children's challenging behavior. And we are going to do a big part of one session on anxiety in children, and actually a little bit today as well.
Okay, there's also a comment about lack of interactions with others impacts their ability to negotiate and problem solve with peers and other adults.
This is, I'm smiling as somebody whose initial training is in developmental psychology, child development, and we know that relationships and interactions are really the foundation of development. And so the question becomes, right, to what extent can we create conditions in which the isolation which many families, many children are experiencing can be, to some extent, overcome and dealt with. How about one more for now, if there's another chat comment there, and then maybe I'll.
Okay, another one is fear level and trauma response are impacted.
The impact of fear and actually to a to a higher or more intense level trauma. There's some of you, depending on your own professional background, may know the term trauma-informed teaching or trauma-informed services, which is a phrase that recognizes the, not just in COVID-19 context, the number of children and adults as well for whom trauma has a significant impact on all aspects of their life, and that the consideration of the potential for trauma to influence children's development and responsiveness is very significant. And I think it's a very positive sign, actually, that people are sort of lifting up awareness of those issues. Thank you both to the folks whose chats I commented on and others. And a reminder to Andy, we're going to save those chats also for the childcare professionals who may be interested in some of those observations as well. Those are very much appreciated and insightful comments. I'm just looking at some notes that I had made as well. You know, probably people were also thinking about, and we will be talking about educational impacts. The phrase learning loss is often used for children who have not been attending school and may not have had access to quality remote instructions, although there are questions as well about the extent to which any even high quality remote instruction can really compensate for some of the educational opportunities that are impacted by remote learning. You may have seen, if you're a New York Times reader, that just this morning there was a special section. I haven't had a chance to read yet, but thankfully that's coming up in a couple of weeks. Schools in the Pandemic, a report card, okay? And the Times, you can also see this online. I'll probably pull some things out of it. A team of Times staff fanned out to 7 school districts around the country, none in the Berkshires, but each of which is taking a different approach to providing education for children, K-12, and each of which is challenged in different ways and is finding its way toward trying to provide the best for children. So there also was a really thought-provoking, just sharing a few other things, recent article in the New York Times reporting on a major study using, interestingly, cell phone data from, what was it, 100,000 schools. And this was a Columbia University study. And the issue here is, and many people know this, I think already, that situations in which classrooms were closed and students were learning remotely were disproportionately non-white and students with low math scores or limited English proficiency, or were in communities where they were qualifying for reduced price lunches. And the lead author says inequality in learning outcomes is only more likely to grow. So, yeah. So educational outcomes, just rolling through a few more. You know, the impact on, this is indirect, but the concerns that adults have about how able they are to support their children. So there are indirect effects there. We talked about anxiety, social interaction. A big one, again, it's indirect, is the impact of for example, family unemployment, job loss. The Society for Research in Child Development, which actually I think Barbara mentioned that I was a fellow many years ago, working actually as a fellow in the U.S. Department of Education. But the Society for Research in Child Development publishes things that are called child evidence briefs. And this one, which just came out last month, is titled COVID-19 Job and Income Loss Jeopardize Child Wellbeing. Income support policies can help as a policy brief. But just to give you a flavor of what we're finding is that the studies show that, this is not surprising maybe, income instability in families, right, reduces children's engagement in school, which also predicts achievement, and school attendance. Income instabilities, the ups and downs of unemployment, both short and longer term, are also associated, depressing list, we'll get more lighthearted, I promise you, are associated with increased school disciplinary infractions, that gets back to an earlier comment, suspensions, expulsions among adolescents, particularly among adolescents of color. And that's just a little sort of snip of the SRCD recent report. And global impacts, I love the work of Nicholas Kristof. And again, this is New York Times, but a really heartbreaking op-ed January 3rd called Starving Children Don't Cry. And again, we're getting powerful but indirect. Globally, the biggest cause of the global crisis, he says, is the coronavirus pandemic, but only indirectly. The casualties are not octogenarians like us with the virus, so much as children dying of hunger because of economic disruptions, or middle-aged adults dying of AIDS because they can't get medicines. He goes on to say an expert panel crunched the numbers and estimated that even under a, quote, moderate scenario of what lies ahead, an additional 186,000 children will die globally from malnutrition because of the consequences of the coronavirus, which is an aspect that, quite honestly, I hadn't been thinking about, but is very, very powerful. UNICEF, by the way, has also published reports on the links between coronavirus and child malnutrition and hunger globally. And so this is a global pandemic with diverse and global consequences. I mentioned just a few minutes ago, Kathy Hirsch-Pasek, who is a professor at Temple University and frequently reports through the media on issues related to the pandemic. I'm crossing my fingers. I think, bear with me. I'm going to share my screen and try to show you a 2 or 3 minute video from a brief presentation that Kathy made on a television program recently that really, I think, helps pull together some of the developmental impacts, but also some hopeful notes. Okay, so now I'm going to share my screen again. You don't mind if I talk to myself, right? Oh my goodness, can you see that?
Yes, we can see it.
Yes, it's on, Mary Lou. Mm-hmm. I don't think we're getting the audio. Is there audio with this?
Oh, yes, there is. Wait a minute. Let me, okay, okay. Wait. Wait a minute.
There's maybe on your share.
And don't discuss
I-
all the tensions that we're feeling
on
around
now?
them. And we're not constantly on our mobile devices. And that's hard. That's really hard because that's how we're connecting. Then our kids are going to be fine. And for some of those kids, this is truly going to be a very, very tough time, even marching forward, because they're noticing food insecurities. They're seeing people they love get sick. They're hearing about germs, hearing about parental anxieties, people losing their jobs, people who no longer can afford to do the things that they could do before. So it's much bigger than a pandemic. It's, unemployment. It's poverty. It's parental self-worth. It's not having food on the table and looking at food deserts. For those children, they are deeply experiencing toxic stress. And toxic stress, continued stress for children, continued rise in the adrenaline levels. Well, yeah, that can have impacts. And those children are going to need to really rely, as will the parents, on the mental health system once it's safe again.
Okay. Stopping that share. Are we back? Yes?
Yes.
Good. Sorry that in the latter part of the video, you could hear the sound, correct?
Yes, the sound was on. We just missed a couple of seconds in the beginning.
Okay. Yeah, that was because I forgot the instruction from my son, the Zoomer, that there's this little thing that you have to click that says share sound. So I have another short video a little bit later in the session, and maybe I will do better. I think I will. Okay. So I liked that video because Kathy really pulls together a lot of what others have been saying, that there are, and this next slide really underscores some of those points, which are, even though there's a general effect of the coronavirus for all children in some way or another, the impacts are and will be different for different children. So this is just like a little brainstorm slide that kind of lays out what some of those differences are and might be. And some of them, again, in later sessions, we will and can talk about more. Age is just a shorthand for developmental differences. I mean, we all know common sense, and some people through training that that 3-year-olds think about everything, including a pandemic, in very different ways and very different interpretations than children of 6 or 9 or 12 or 17 or people in our age group. And their level of understanding, their emotional development, their language growth, all of those developmental changes go into what they can bring to their understanding of an emotional response to something like COVID-19. But there are also differences in impacts that are related to a variety of individual differences and contextual differences. And just a few of those are listed there, but just one example, and this will come up in other sessions. Researchers, whether you're looking at health disparities or other kinds of impacts, ethnicity, race and ethnicity have a big and actually rather complex influence. There certainly are, for example, and I said health isn't my specialty, but for example, there are disparities in the impact of the coronavirus among communities of color, right? But there also are other ethnic impacts. There is a very recent study by a group that, again, all of these are in your resources. There's a group called Child Trends. Some of you may be familiar, based in Washington, not a government organization. They're a nonprofit kind of think tank, research to policy kind of group. And they just recently pulled together a study that really shows that the kind of hardships that really create negative impacts among families, children, the more they pile up, the worse they are, right? Those kind of multiple hardships that occur at the same time, the kind of life events where people have gotten sick, they've lost their job, they have to move, etc., all at the same time. That kind of pileup is more often seen statistically among Black and Latino families than white families. And anything that's happening within the family is affecting children. Child Trends notes that some of those differences really seem to go back to poverty. So, if it's harder for families to gain economic stability by having a steady job, for example, they don't have sort of a cushion or a buffer against some of the impacts of health emergencies. This is going to come up again in later sessions, so let's maybe leave it there. And however, I also wanted to say that the focus will be, in my mind, not only what the challenges are, what we're focusing on right now, but on what some promising supports, preventive strategies, interventions are to minimize risks and maximize strengths. And I think it's fair to say, thinking about the last few days in our country, that there is and will be increased attention at the federal level, as there is in many but not all states, on the underlying conditions, such as the ones that I just referred to. So I said we could go a little lighter now. And what I like to do is to try to get inside children's heads for a few minutes. Children think about all sorts of things, right? And COVID-19 is certainly at the top of mind for adults, but also for children. And this is a video, and I will remember to click the little box. Other than that, it seemed to go pretty well. This video, interestingly, was done by the Atlantic Monthly. Who knew that they, not me, that they did videos? They interviewed maybe a half a dozen children about their thoughts and concerns about the pandemic. So let's have a look and see what insight that provides. All right. Whoops. I forgot again. Wait a minute, let me go back. Oh, you know what? It remembered that I wanted to share the sound. Okay. It was way ahead of me there. All right, here we go. Again, this is just a little, I don't know, 5 minutes or such. Lovely, lovely.
You have to get up, okay? You're not talking to the lady. Okay, good boy.
My name is Rebecca Joseph.
My name is Hiro Nakamura.
My name's Yeliana. I was born in Atlanta, then moved to Maine, then I moved here.
For one, I love history.
And I like doing sports.
Mom calls me an independent person.
It's a virus that started in China.
And then something happened that it got spread all over the world.
And now it's turned into a very serious virus.
Well, my friends told me about it. They're like, "Oh, have you heard about coronavirus?" I was like, "No, what's that?" And they're like, "Oh, it's the same kind of like the flu."
After a couple of days, you'll start feeling better, but then it comes back even worse, which it's kind of like a trickster virus.
Coronavirus's weakness is soap. A lot of the people are like, "I'll be fine from it," but then they could spread it to other people that could die from it. Well, I feel really nervous and stuff. I feel a little worried.
I feel scared.
I've been feeling a little bit worried.
Partly it feels kind of cool because I get to live through something that'll probably be in history. But it's also kind of scary.
So it's going to other countries so fast, it just scares me. And my grandma, she's on the older side, and we don't want to spread germs to her.
I don't want to get it, and I don't want my family to get it. And I hope they find a cure because it's going to be very hard without a cure.
I'm worried about my family getting infected. If I get infected, then that's trouble for me, yes. But if my family gets infected, that's a worse thing.
I've heard people with already medical conditions who already have medical conditions could it'll be even worse for them. And I have asthma, so that kind of scares me because I have asthma.
The most that I'm worried about is that this will go on for a long time. We're just at the start of it.
Well, usually if I think about it, I would actually start about to cry, so I take a breath, probably look for something to read, then calm myself down. I just want it to be over with as soon as possible.
Adults should be following the rules and then making sure their kids are following the rules.
I think they're already doing this with trying mixing medicines.
Because what if all of a sudden a new type of plant comes in and scientists use it for a coronavirus vaccine and it works?
They should really help their kids know what to do. I feel like they should tell people to wash their hands, which my dad says to my uncle. I think they just should stay calm, get regular exercises in areas with people, with not a lot of people.
Technically, if they mess something up, we're the next adults, so we have to fix it.
Okay, we're back. That's really something, isn't it? Yeah, I'm wondering if we want to have some chats now. I think I'm going to go on because I want to get into some good tips and resources about how to talk to children about the pandemic, and then maybe carve out some time toward the end for sort of cycling back. I have to tell you that yesterday I was Zooming with my son, who teaches all his university classes on Zoom, and he teaches master's students in school psychology. And I was sort of practicing sharing my screen, right, with his tutelage. And he said, "Mom, can you send me the link to that video?" Because some of his school psychology interns were wanting to have more insight into how kids are really, in the schools where they're working, how the kids are really thinking and how they can talk to the kids and so on. So anyway, he's got all this stuff as well. Anyway, before we talk about how to, suggestions for how to talk to children about this, I also want to show you, there we go. Okay, something else that I found in the kids section of the New York Times, I don't know, a month or more ago. So there was this kid, Lucas Smith, 9 years old, had this idea that he wanted to find out what kids in different parts of the country had learned from the last year. So I had to scan this in, so I apologize if it's a little hard to read, and that this isn't in your resources, it's just a scan, but it's, every level of thinking. So this is just a little compilation. He had the idea first, and then this kid decided to, find out from kids all over the place things, everything from, you can read it, daytime pajamas make good school attire, to more serious things like the world is a fragile place. And I love this one. Great parents aren't always great teachers. And I think many of us who are or have been parents or as grandparents are helping with some of that could really attest to that. Also, I love from the 10-year-old Sadie McMahon, I love and hate my family. And I have a feeling it's not original with Liam Chapman. I think I've read this elsewhere, but be cat-like, nap, eat, avoid humans. Real friends actually stick with you. And then the last one, which is this boy, Lucas Smith, who kind of came up with the idea of asking bunches of people, lifesavers, doctors, cousins, teachers, elections, Minecraft. You know what that reminds me of, and I think we will get into this a bit more later in this session, is if you love or loved Mr. Rogers, one of the things that he always used to say, and people who work with the Mr. Rogers world still and the media always go back to, tell children to look for the helpers. There are always helpers. Whatever natural disaster is happening, whatever scary thing. I think he said at one point that his mother used to say to him when he would be, oh, it's so whatever, look for the helpers. And I really love that. So how to help? And if we run out of time, I think we're okay. We can always continue with some of these resources next week, but some ideas for how adults, parents, grandparents, teachers, other caregivers can communicate with children about those issues. The materials that are connected with this week's session have a lot of good resources that you can explore, and the general resources, almost every website that you can imagine, and under general, they're all, every professional association, from the American Psychological Association, the school psychologists, NAEYC, everybody seems to have something about how to talk to children. So this is really just the sort of the tip of the iceberg, so to speak. Looking for something, excuse me 1 minute here, there we go. A particularly nice resource, I thought, was, because concise, direct, but not the only one, so look at the list, is this I adapted from, some of you may know Nemours, A. DuPont Children's Hospital and so on in Delaware, really a highly respected, high-level children's hospital health facility, and they have on their website something called Kids Health, with all kinds of resources, physical health, but also developmental and so on. And they have, again, you have a link to it, they have maybe like a 2-pager about how to talk to your child, but for teachers, especially with younger children, but not only, and other care providers and so on. I think a lot of these insights are good. On the slide, I just sort of bulleted a few of the key points. Maybe I can just say a few more words about those. A lot of it is, it would be similar if you are talking to a child about sex, if you're talking about divorce, if you're talking about serious illness, death, what we used to call tender topics. Right? And the first suggestion is find out what the child already knows. I always think about the story, probably apocryphal, of the kid who comes to, let's say it was mother, and says, "Mom, where did I come from?" And mom is like, "Oh, I know this is going to come sometime," and launches into an elaborate description of the birds and the bees and so on and on and on with the anatomy and the relationships and so on. And there's a long pause, and then the child says, "Wow, Jimmy is from Brooklyn." So find out what the child already knows. Really the issues around the child's not only age level, older children asking things like, what have you been hearing about the coronavirus lately? What questions do you have? Younger children, there's sickness going around, do you have questions about it? And following the child's lead, rather than assuming that your child wants to spend time talking about this, but if the children don't seem interested, then for the time being, that's probably okay. Then the second tip is offer comfort with honesty. It's important, and we'll talk later more about anxiety, but it's important to help children feel safe, but also to be truthful with them. Not more than the child is interested in or can handle, but if they ask something specific, like why are those stores closed, or depending on their age, answering the question, but not 10 levels above it. And saying that you don't know the answer if you don't know the answer. Trying to be calm and letting them share their fears and their worries, so that they feel comfortable coming to adults, whether it's a teacher or a parent. And pointing them, I think this is an important point that was made in that resource, pointing them toward, especially as they get older, age-appropriate content, so that they're not just looking at online resources or news that is really only going to confuse them and perhaps frighten them. There is, and the resources that I'm trying to provide can be helpful. There is a lot of age-appropriate content for children, and I will be giving a couple more examples of that. Helping children feel in control. And that's easier said than done, but the suggestions include giving your children specific things to do to feel in control. And things as simple as hand washing and mask wearing, stuff that they can do, and why it's important. And this goes back to look to the helpers, talking about with children all the things that are happening to keep people safe and healthy. And fortunately, even though we're at a terrible time, now we also are at the beginning of a more hopeful time, and that's something that can be communicated to children. And this is also something that, as I'm thinking about that video from the Atlantic, that the kids' health people make the point that children often worry more about their family and their friends than about themselves. And just to be sensitive to, it's not all about their worrying about themselves. Like the child on the video who said, I'm worried about, because my grandmother is in the older age group and I don't want her to get sick. But then there was also the little girl who has asthma. And she said, I've heard that if people have underlying conditions, they may be more at risk. And really letting children know that it is normal to feel stressed out at times. And I have some resources that I'll share before a later session. Actually, it's some resources that UNICEF developed for the Europe, South Asia region about helping parents help children deal with their own stress and also adult stress. And then finally, keeping the conversation going. Checking in with your child. This is sort of, I think, like the talk about sex or something, that none of these things are a one-shot deal. Children have to process and they may cycle back, and they may feel comfortable sharing questions or worries, not initially, but later on. And using this as not an over obsessive, as I think Kathy Hirsch-Pasek referred to, so that we're not obsessing with children about it all the time, but just checking in and talking with them often so that the conversation is a continuing conversation, not a one shot. Now I'm going to try to show you one more resource, and for some reason I think I may have to go into my little Word document, but I don't think it'll take very long. This is a video that can be shared with children. It's like a 3-minute video for kids that can be downloaded. It's in the resources with a guide for families, which I think is great. A viewing guide in English or in Spanish, maybe other languages, I'm not sure. All right, fingers crossed, because for some reason it wouldn't. Oh, there it is. Okay, and share sound is still there. All right, I think we're good to go, people. I just have to get down to the little arrow. There we go. Okay, this is called All About Coronavirus, a video for children.
Coronavirus is a word people are talking about a lot lately. The coronavirus is a kind of germ that is making people sick all over the world.
I'm sorry, it's buffering a little bit. I think it'll be okay.
This kind of coronavirus is a new germ, and we are still learning about it. Maybe you've had to stay home from school before, or missed a basketball game or a dance recital when you didn't feel well. Part of the reason you stay home when you're sick is to feel better, and the other part is that when you're sick you can be contagious, which means your germs can spread to someone else and get them sick. One thing we do know about the coronavirus is that it is very contagious. When someone gets sick from it, they can spread it to other people through coughing, sneezing, touching hands, and even talking too closely. For some people, the virus makes them feel only a little bit sick, like they have a small cold. For other people, the virus makes them feel very sick. When they do get very sick, they get a fever, a bad cough, and can have trouble breathing. Someone who gets the virus can pass their germs to other people, even if they don't feel very sick. That's why we all need to work together to make sure the coronavirus doesn't make more people sick. Some of the things we can all do are things that you do at home and school all the time. Wash your hands often with soap and water, cover your cough and sneeze into your elbow. Some of the things we are all doing together are new things, like staying home from school, not playing with our friends, not going to playgrounds or sports practices. You might have heard people call the way we're acting social distancing. Everyone has added some extra distance to their personal space to stop germs from spreading between us. It is not easy to stay apart from our friends and family members who live outside our own homes, but we can stay connected through phone calls, video chats, and even by mailing cards, letters, and drawings. When the germs do spread around, we have doctors and nurses working to help people feel better. You might be scared or confused about everything that is happening, and that's okay. But there are lots of people trying hard every day to make things better. You can be a helper too. Wash your hands a lot. Be patient with the adults around you. Wear a mask when you're out of the house and around people, and encourage your friends to learn about coronavirus. Thanks for watching.
We're back. You can hear? Yeah. As I said, that little video does have there's a link to the video, and then there's kind of a discussion guide for adults if they choose to watch that video. Also wanted to mention, I'm not going to show this, but a couple of other things. There are print resources that teachers or parents or grandparents, depending on the situation, might want to think about in talking with children. I found one example that was developed by National Public Broadcasting. They had a bunch of interviews that they had done with child development experts, Joy Osofsky, some of you may know, media experts from Sesame Workshop and so on. And they took the content and they developed sort of a COVID comic book. I mean, you can get a feeling if you look at the slide. It can be viewed online, or it can be, apparently, I haven't tried this, downloaded to become a zine. I mean, like you fold it up and you can make like a little book of it. When I previewed it, I think this would be maybe children 7 or 8 and older. It's kind of a funky kind of thing. Anyway, also there's a mention, I didn't have a chance to look at it, but in your resources, the American Psychological Association has, among their resources, developed a picture book that I believe can be read online, maybe downloaded as well. Anyway, there are a lot more print resources like that. So, yay. Here we are with what I want to do is just sort of bundle together any general comments, examples from your experience, questions. If you want to use the chat function, please do that. And Karen will help me with that. Or if you're used to the hand raising thing that Andy described, which either is, depending on whether you have an updated Zoom, you either get to it through wherever your list of participants is, click on that, there's hand raise, and then we can see. What did I just do? What did I just do? Oh, all right, I don't know. There we go. Actually, let me go back. There we go. Okay, so reactions, questions, observations, experiences, anything at all, either hand raising or chatting.
Mary Lou, I can just go back and mention some of the other ideas that were mentioned in terms of the impact on children, because we didn't cover all of those.
Sure.
Okay, one was on a child's speech and language development. Another one was,
okay.
We mentioned,
how about hold that one? Yeah, let me just make a comment about that maybe. That's interesting. I'm glad that we're saving the chats because I'd like to think some more about that. And it also ties in with the next couple of sessions. It has to do with language stimulation and language input and the role of extended families. It also makes me, I'm just kind of free associating here. It also, however, makes me think of something that we are going to look at later on, which is impacts on English language learners, children who themselves and family members do not speak, in the case of our country, English, the dominant language, and the challenges that are presented by not being in school and so on. If I can interrupt, Karen, there's a hand raised from Terry. Do you know how to, oh, I see. Now, what do I
thought it was.
There you are, Terry. Terry.
Quick question. Do children understand the term being stressed out? If you try to ask them if they're stressed out?
You know, I think it depends, maybe other people, grandparents, and so we have college age grandkids, but I think it depends entirely on the age. But maybe it's a little bit, is it a little 60s thing? I don't know. I think some children understand those terms. I think many children really do understand on some level the concept of stress. I think a lot of kids, I mean, beyond, even with preschool children, there are now, you know, within childcare centers and preschools, yoga sessions and using the term stress, maybe not stressed out, but I think the concept of stress and that vocabulary is more widespread than we might think, but certainly children over the age of 5 or so.
Thank you.
Also, Mary Lou,
I want to go back to you and see what else.
One of the other comments that Claudia mentioned in line with stress was children, I think, picking up the vibes from their parents. If their parents are stressed out or in distress because of job situations or getting food on the table, the children have a sense and will pick that up from their parents.
Yeah, and again, oh, I know, this is really, it's so hard to think about because the level of stress, right, that some families are experiencing, this goes back to also what I mentioned about the study that the Child Trends research team did, that we know that pileups of stress from multiple stressors have almost like an exponential effect on an impact on families as well as children. And everyone is experiencing stress, but my goodness, some families are experiencing it much more than others. And I think the challenge there And again, I think this is good for me to hear because I was thinking about it, but I think, maybe it needs more stress. No pun intended, but there's a tension, it seems to me, between adults just sort of trying to put on a happy face and pretend that everything is fine, you know what I mean? Which even young children usually can tell when that fake kind of thing is going on. And wallowing in it, and I think Kathy Hirsch-Pasek was kind of addressing that as well. Certainly sharing with children, depending again on their age and their level of understanding and so on. It's not harmful, it seems to me, others may have other ideas, for children to know that there are things that their parents are worried about, but coupled with, as with other kinds of crises, they need to know that the grown-ups are in charge, right? And that there are helpers. And I would go back also, not only for the youngest children, but older children as well. We know that one of the strongest protective factors against the harmful effects of stress is having a secure relationship with an adult. It's usually a parent, not necessarily. Even, this is really going back to child development research. There in the research on resilience, there are children who have, within their own family, really fraught, difficult relationships, may have a parent with for example, a serious mental illness. And what resilience researchers have found over the years is that oftentimes that's a big risk factor. But if there is even one person in that child's life, it might be the neighbor down the hall in the apartment building, or it might be a family visitor, a childcare teacher, who really has a genuine warm attachment to that child. That is one of the things that can have a buffering or cushioning effect. Not, it's not a vaccine inoculation that protects forever, but yeah.
Okay, another comment, which actually I'll respond a little bit to. Brian mentioned the difficulty of reading people's emotions because a mask is now covering half of a person's face. And my whole background is with working with profoundly deaf children. And all of a sudden covering up the ability to lip read or speech read or to get those facial clues has impacted greatly, but not only with children, with adults that are in hospitals and are sick and facing a whole series of masks and not getting that emotional interaction.
This is also one of the sort of differentiating factors that I think I mentioned on an earlier slide, is children who have disabilities or other special needs. I have all these thoughts zooming around in my mind, but I do know, Karen, that I've seen reference to masks that have been developed that have a clear plastic part, so which can be really helpful. But I've had a conversation about that with a speech pathologist. I was going to share this because I trip over my words occasionally. I had a mild stroke back in September and had some apraxia and had wonderful speech therapy and had the opportunity, we really hit it off. And besides the good therapy, we had conversations about all kinds of things. And she was talking about those challenges as well. I would mention one other, which for children who have more than the usual difficulty, this gets back to, I forget who you said made the comment, Karen, but reading facial expressions and so on. And developmentally, this is very important. The first research that I did was about facial expressions of emotion with a colleague and a very senior colleague at the University of Delaware. And we rely on those a lot, but especially when you think of children, for example, who are on the autism spectrum, okay, who have particular difficulty interpreting, making inferences about how people may be feeling and responding appropriately and so on. I mention that partly because I have a not immediate family member, but a member of my extended family who has, I think at this point, kindergarten age child who is on the autism spectrum. And they made a decision, and there's no right or wrong answers to any of this, but this year, for a number of reasons, they made a decision to, at least for a chunk of time, to keep him out of school, partly because he was having, the whole concept of people wearing masks was kind of frightening to him and upsetting to him, but also he was having great difficulty with developing the social competence, that part of which involves being able to figure out how people are feeling based on your facial expressions and so on. And so there were more alternatives outside of school, doing things at home than in school. So those are just, you know, kind of top of my head thoughts about that, but I think that that is a complicated question. And again, what can we find to compensate for that? And I think as schools reopen, that's going to be, you know, when children are learning remotely, then they don't have a mask on. But when they're in school, they're going to have to. So, all right. Let's see. I think actually, unless there was something really pressing, I think perhaps if there are other points or questions, let's hold those for the next session and I'll have a look at them. I'd like to just spend a couple of minutes before we close previewing what's going to be happening next week, okay? Primary focus, and it connects with a lot of things that we've already been talking about, children's emotional development and COVID-19. Primary focus, but we can slop back and forth, children under age 5. And again, what are the goals for their development? What do we want to see building across those years in their feelings about themselves, about other people? We can include social competence in some of that. And how is the pandemic challenging that development? Some of the things that I can share resources on and we can talk about are a variety of ideas for supporting typical emotional development in the first 5 years of life, perhaps also with a related emphasis on children with disabilities. I want to spend quite a bit of time on connecting with the relationships issue, and in particular because of the Ollie group, tips for, and there's a ton of resources for not talking about the coronavirus, but connecting children with grandparents and others. There are tips about doing video calls and so on. Anyway, there's, you know, again, not little handy dandy, there's one right answer for everything, but there are some really useful resources. I also thought, since in our extended family for this this Ollie course, there are people who are very engaged in and thinking a lot about home visiting, which kind of is a contradiction in terms during a pandemic. But there are wonderful examples of how both for families under stress, families with children who require early intervention, what are some of the creative ways in which organizations, individual providers are trying to adapt the basic rationale behind this kind of support for children and their families during the pandemic. So, and other things. And I want to put in a final pitch for you as within this particular area, but others, if there are areas, issues that you really are kind of burning to talk about, to learn more about, to share, then let me know, because I deliberately haven't like set every little thing in stone. So, you know, let's collaborate on that. So I just want to end with a big thank you for your involvement. And I look forward to continuing to do this in the coming weeks. Thanks again.
Thank you.
Thank you.
Thank you. I don't know how to say goodbye. Goodbye.
You did. Thank
Did
you.
I did it? Did I did it?
Absolutely.
Okay. It's like, I don't know where to go.
Thanks a lot.
Okay.
Enjoyed it.
All right, thanks, Mary Lou. Thanks, Karen. Thank you, everyone. And yeah, once the recording is ready, I'll go ahead and get that out to everyone.
That's great. Thank you. And